I appreciate everyone for coming. Thank you for your interest, and I hope that we all gain something from this experience together. I would actually like to start out by a very simple question, and especially poignant since we do have a good 30% who do not have experience in this area. The first question is, what does it mean to be transgender? And I'm going to start off with Kelly in the panel. Kelly, if you could share about this, and then others who might want to join in can do that. Thank you.
Sure thing. Thank you so much, Chance. First, I just want to say I really appreciate the opportunity to address the community here at Vanderbilt Nursing and the community at large. I'm a real person like anybody else here. I have 2 adult daughters, 7 grandchildren. I've been married for more than 30 years. I had a fairly high visibility job at a global automotive company. I was active in my church. The struggle is, for years, I knew in my heart that my gender at birth didn't align with the physical sex I was born with. Becoming my authentic self as a woman I knew I was required getting to a place of personal acceptance. And that's what it means to be transgender today, for me.
Excellent. I would like to follow that question with actually moving to Nicole. Part of this talk will be about healthcare and how the interface between transgender health and healthcare, and Nicole has worked in this area. So I would like to ask you, how did you become interested in caring for people who identify as transgender?
Yeah, thanks so much, Chance, and thanks for helping facilitate this session here. Kelly, I loved your answer there. It's just such a short, poignant definition of what it means to be transgender, and that was to come to an acceptance of who you are. And I really loved that. I'll share with you my own experience. I'm a nurse midwife in background and training, spent 10 years in practice, and very early in my career, I was seeing patients, and the patients that I was seeing at this particular clinic were patients who were seeking care after having experienced a miscarriage or an abortion, and they were coming in for their follow-up visit a few weeks later. And, this was often a very quick appointment. I would get a quick sexual and reproductive health history, and we would go over contraceptive options. And one night I was just doing the normal thing. I was just working clinic, and I went into the next room and I sat down and had a conversation about the individual sexual and reproductive health with the individual that was sitting in front of me. And this young person, as we were kind of wrapping up the questions and I was turning the conversation to, what's going to work for you for contraception moving forward. And they kind of just shyly looked up at me and said, well, Nicole, you just, I appreciate all these questions you've asked, but it's hard for me to answer that because I think I'm a boy. And I had never experienced a patient, sharing that with me. And I just sat back for just a minute and I wasn't sure how to respond. And I just said what was kind of the only thing I thought I could is I said, well, thanks so much for sharing that with me. I feel like I should ask, is there anything I can do to help you right now? And this person just shared that they had been looking for a provider for some time. They didn't have access in the city where I currently live, Memphis, to anyone who provided transgender care. And they said, Nicole, I just don't know who to ask for help. And I said, well, let me put my thinking cap on. I don't know the answer to that either. I didn't receive any education or training in my years of education about how to offer care for a transgender person. Would you let me call you back? And I had an opportunity about 6 months later to go to a conference where there were a lot of conference presentations that were centered on the care of transgender folks. And I went to all the sessions and I came back and I called that young person back and said, would you be interested in coming in and having a visit with me? And I think I might feel better about offering you some care now. And that was the beginning of a long journey. But that just gives you a little window.
Thank you, Nicole. I want to circle back around to Kelly, and if you could come back to your perspective and your interface with the healthcare system and your journey as a transgender person. What obstacles have you faced, and what was your experience like from the other side as a patient?
There's so many layers to that question, Chance. Excuse me. Getting to the point where I was willing to accept that I wanted to make a change was the jumping off point. The struggle is when you're faced with that kind of a challenge, who do you go to for information? Who can you trust and feel safe with? For me, I did probably what many people do. I started looking at the internet. I went to my buddy Google, and me and my friend Google started doing all kinds of searches. And I mean, everybody knows a lot of the information on the internet is good, but how do you discern what's valuable and what's not? And so for many transgender people, the first step is to begin hormone therapy of some kind. So I knew I wanted to do that, but I didn't necessarily have a doctor that I felt safe with. So I started ordering hormones online. And, you know, I'm smart enough to know that's probably not the best option. And so I knew that I couldn't keep doing that. And if I was really serious about this, then from a timing perspective and a health perspective, I needed to make better decisions. So I started looking around at who would be safe. And that was when I was first introduced to Dore as part of the LGBTQ health program at Vanderbilt. I'd already had some experience with Vanderbilt in a surgery setting, so I felt pretty confident that would be a good place to start. And Dore and I developed a reputation. My endocrinologist I was seeing at the time didn't feel comfortable or wouldn't serve me in that way. And so when I reached out to Dore, he recommended Dr. Ucsf. And so I met with Dr. Ucsf, and that's when the real education process began for me, because Dr. Ucsf was patient and kind and able to share a lot of really good information. She recommended some therapists that I could see. There's this thing called empath, and I'm sure we'll talk about that later, but it's essentially guidelines for providing transgender healthcare. And depending on the organization or doctor you go to, there's some really good guidelines to that place. My experience at Vanderbilt has been nothing short of amazing, and I've really had wonderful experiences there. But taking hormones isn't the end of the journey. That's really very basic beginning. And I have other healthcare needs. So the primary care physician I was seeing, I knew was not going to be the person that I wanted to continue with, particularly in the midst of transition. So again, I reached out to Dore. And one of the benefits of having a group like the LGBTQ Health Initiative at Vanderbilt is that we have a ton of resources available. And that was really my first introduction to it. So Dore referred me or recommended that I see Dr. Taylor. And Shane Taylor at that time was still an intern, or I'm sorry, was finishing her residency. And there wasn't an official LGBTQ health primary care group yet, but she was just so open and honest, and the time that I spent with her was very affirming, to the point that I felt completely comfortable and had no question that she had my best interest at heart. And now she actually leads that program, so I'm really fortunate in that respect. I also worked for a very affirming company, and so my transition at work, although potentially devastating, was really well managed, and it was personally well received by most people that work there. Unfortunately, that's not everyone's experience. And for me, somebody like myself who was very active in the church, that was another story entirely, right? So, you know, being part of a evangelical church in the South, they weren't really holding much space for acceptance, and church was a big part of my life. So that was probably one of the most devastating points. But being part of the Vanderbilt University Health Community Advisory Board for me has been a wonderful experience, and I get to remain engaged and talk about something that's near and dear to my heart. And my hope and goal is that we can improve health initiatives and care for the LGBT community, and really give people a sense of safety for everyone who's involved.
Thank you, Kelly. So a safe, affirming, and supportive community is really important. And practicing with the guidelines that are available. And I know those are still being made as we go. On this note, switching over to Barbara and Carla, I'd like to hear a little about the clinic that she was referring to, maybe how it came about, and what's the process on your end for people coming to get help.
You want to start, Carla? Yeah, the process.
And sorry, I didn't say who first.
It's okay. The process for getting connected depends for the clinic that Kelly was referencing is a little different than the clinic that Barb and I work in. As an adult, to get into the clinic, it's pretty, you can reach out to Dore Zimmerman. He's a great resource, and he can kind of funnel that referral over to Shane Taylor. Or you can just call and ask for an appointment with Shane Taylor. She's a primary care physician, so you don't need a referral, you don't need anything. You can just kind of reach out to her, and if she's full, then they have other providers that are coming on board that she can kind of connect you with. I can't think of their names off the top of my tongue. The pediatric clinic, adolescent pediatric clinic, is actually kind of along the same lines. You don't have to have a referral. Families can call in. We have a direct line that they can call. You don't have to have anything from a doctor. We get several calls, sometimes from a teen themselves who is self-referring, sometimes from a parent, and we also do get referrals from doctors. But it doesn't take much to get into our clinic, and the clinic itself kind of formally founded about, from what I can gather, about 2 to 3 years ago. But our providers, Dr. Najjar has been providing transgender care, I want to say, for at least the last 15 years, probably longer, but she won't divulge that information. And then Dr. Brady came on board after getting training in Cincinnati, and really kind of transitioned an adolescent and OBGYN health program into the transgender program for our gender diverse population. And it's just kind of blossomed and grown since then.
Barbara, do you have anything to add to this? Thank you.
Just speaking to the issue of guidelines, that is really, really important in pediatrics. We want to make sure that we are providing very safe care that focuses on the child's well-being. And so we use, in my particular specialty, because I do pediatric endocrinology, the guidelines we use are from the Endocrine Society. But there are also guidelines from the World Professional Association for Transgender Health, which is known as WPATH. The American Academy of Pediatrics has some guidelines. The American Academy of Child and Adolescent Psychiatry also have guidelines. So we always want to assure children and their parents that what we are doing is based in the best information, best science we have right now, and that we are doing things safely and according to established guidelines.
Great. So go ahead, Nicole.
This was going to chime in there. I talked about going and learning more about transgender care, and one of the big pieces, I provide adult transgender care, and for them, in addition to some of the guidelines that Barb just listed, are UCSF primary care guidelines for the care of transgender, and they do focus on adults, and so they were the guidelines that I chose to follow.
Excellent. So I was going to say, we've come from Dr. Google in the conversation all the way to actually supported guidelines, evidence-based practice. And then also I've heard how confusing it can be, because Vanderbilt is a big place, and this is just Vanderbilt alone. Where's the entry point? Who do you find that would support and affirm? And so we have a resource list for you as well that's given as part of this talk. And on the note of guidelines, so there's another side of this. It's education of the providers so that they can provide the care that is needed, and follow guidelines and create more guidelines with research. So I'll bring Dean Shorn into this conversation, and I'd like to hear something about where the nurse practitioner curriculum is in regards to caring for transgender patients.
Well, thanks, Jance. And I think it's really about, it's very broad. It's not just the education program or education itself for nurses, much less, advanced practice nurses. It's the curriculum, but it's also the way in which we deliver that curriculum. What are schools doing to be inclusive generally for all people? So we have transgender students. We don't currently, but we could, as far as I know, but we could have a transgender faculty member. We need to be a very inclusive environment, just as Kelly talked about her work environment being inclusive. Our work environment and learning environment also needs to be inclusive. So I can't help to throw that in there. From the education side, what I really am excited about is the American Association of Colleges of Nursing are developing new essential guidelines. For those of you who have a little bit of passion for nursing education, or you wonder where all this curriculum comes from, there is a national organization that sort of tells us the broad guidelines that need to be in nursing education. And the new essentials they have diversity, inclusivity, and equity all threaded throughout everything from population health to ethics to even inquiry, scholarly inquiry of where all that is embedded. So where we've learned that it doesn't work to have a separate course in this, right? It needs to be embedded, that the AACN is also seeing that as well in the essentials, that this has to be embedded, caring for all types, all people, no matter how they identify, is critically important. And I loved Nicole's example of how she was exposed, because especially for the students on here, I mean, all students have a desire to have every experience possible when they're a student, right? They want to take care of every disease that there's possible they could do when they're out, or every social, issue or circumstance or type population. So many things we want to learn when we're students, and we're just not faced with. We don't necessarily have the opportunity to have the clinical experience with all populations. But I think the take home for students, hopefully, is to be what Nicole modeled there, to be a safe provider, that then somebody can be open enough to say what's on their mind, whatever that is. If it's their sexual identity, which is what we're talking about, or gender identity, but we're talking about right now, it's that. It could be something totally different. But by being a safe, accepting, non-judgmental kind of a provider, it's amazing the things that people will share with you. And then many people have gotten hurt by sharing and then find out that didn't work. But if you're open and you receive it, they will continue to share what they have on their mind, and you will find out how to get the care, just as Nicole did. You may not be the right person to provide the care. It may be somebody else, and you will find out where they need to go. But I do think that a take home for students is that you don't always have to have the experience with a particular situation to still be open and be able to help people, and for them to open up. Also, students often, it's not unusual to have students to say, what about, there is a transgender clinic here. What about having a clinical rotation there? what I want to have everyone think about before I get a whole bunch of emails asking about that is that that's a very vulnerable population, right? Having a very specialized clinic is so important for their care. Now, I just think about layering students that rotate in and out, that have no relationship with the patients, that's really tough. It's similar to a lot of other kinds of areas where we have extremely vulnerable patients. And it's also a very specialized kind of clinic when as students, you're really trying to get that general competency for practice, then you specialize. If you want to go on and specialize, we've had several graduates go on and specialize in sexual and reproductive health. And it's not that they had a huge rotation in school, it's that they had the broad foundation and then they sought that out, just like others who have gone into other specialized areas. So I just thought I would mention that. I'm open to other questions about education.
Excellent. Thank you very much. I'd actually like to skip to Nicole for a moment and ask her about nursing boards and exams, and have they kept up with this?
Yeah. So thanks, and that's a good segue from some of the topics Mavis was introducing there with, you know, anytime we have a specific disease or a specific patient population that we want to hone in on, it's difficult to give students an opportunity to learn every single thing that's out there. But as Mavis also mentioned, there has been broad recognition, starting with some initiatives from, you know, CMS and HHS perspective. In 2015, they did a large national survey of transgender individuals about what kind of health impacts, you know, being a transgender individual has and what kind of health needs are there. And that really shed some light on sort of the urgent need to ensure that providers are starting to provide care, and that as providers, we are getting the education and training that we need. And one of the places that starts is within each specialty, acknowledging that there has to be some baseline of expected knowledge. So one way is to do it, as Mavis indicated, sort of broadly, weaving it integrated into the curriculum. And then another way is for each individual specialty to think about how can we require this content to be something that, as a licensed, you know, credentialed nurse midwife, or as the licensed credentialed women's health nurse practitioner or family, how can we make sure that in fact we're holding a bar of sort of evidence that you are being given this education and that you have some basis. So I don't know every specialty. You know, Barb Duffy here may know more about pediatric, but I do know that two specialties, so women's health specifically and American College of Nurse Midwives, women's health nurse practitioners, they do include board questions on their board exam about both men and transgender. I think that's really important because it's acknowledging that, yes, we specialize in women's health, but in fact, we are specialists for all people around these topics. And then American College of Nurse Midwives, they have a position statement, but and they're currently working to integrate it into their board exams.
Great, thank you for that information. So there's a web of flow of information from the questions getting onto the boards, from the national guidelines that guide schools into what is in the curriculum, and then implementing that into the curriculum. And then there's all the different specialties that it needs to be inserted into. I know from the psychiatric specialty where I teach, we have actually invited Nicole to give a lecture on psychiatric practice with regards to transgender health. It's one of the ways we've tried to implement that. And I'm just wondering if anyone knows, are there any certain specialties that are ahead of the curve, or are there any specialties that haven't been spoken about that someone could say, this is what we're doing here? Anyone know?
I have no idea. what's going on in heat. I asked a colleague today, and you know, I don't know that. I just don't know actually how it's being addressed in curricula right now.
I mentioned both nurse midwives and women's health because I think that they have been some front runners on this, but actually Chance, the American psychology, they also early on did some work on this and published some guidelines. I know we've listed those on a resource list that's going to be made available after today's, you know, I think you mentioned that earlier, after today's call. And they did a real in-depth look, and in 2017, they updated their guidelines on it, where they really define what is the definition of what is it to be a transgender individual or non-binary, and then what health needs do folks who identify in that category, what health needs are important to address with them. And that has been huge in moving the needle forward and ensuring that people aren't assigned a diagnosis that is stigmatizing to them, that this is not categorized as, you know, a sexual deviation. It's not, and it's there's been a long history of making sure that it's not categorized that way. And then the American Medical Association has also worked hard to, you know, really address that issue and how we are diagnosing it and how we then are working with our patients to ensure they have good health care.
I might just add a little bit, and that is that I don't know that there's any particular specialty that is a more ahead than another. They might be, you know, like on a national scale, but I would challenge any of our participants, our members that are listening, that it doesn't matter which specialty you're in, and it almost doesn't matter what your professional organization is doing. You owe it to every person that you're going to be caring for to understand more about how to talk to people and how to just to be up to date. You can find out more details and referral and all those things, like I said. So whether you're a neonatal nurse practitioner who may have parents come in, or you may be, you think you're going to be caring mostly for women, but then somebody else comes, I mean, it doesn't matter what your specialty is, you still have to understand this. And it overflows into policy work, because you're going to be asked as a healthcare provider, what do you think? You know, I don't know if any of you on the call have even opened a paper today. We were talking about how many things have been out as of today. I don't mean to be jumping the gun on anything, but there's, you know, policies here and there trying to limit both healthcare as well as other kinds of activities that we as healthcare providers should have a voice in how our legislators are making policy. So anyway, I'll let other people pipe in on that, but I think it's as providers, we owe it, no matter what specialty we're in, to understand this topic.
And Mavis, I would echo that. And in fact, CDC has an excellent webpage on you know, lesbian, gay, bisexual, and transgender health, and that's also echoed in our national guidelines for improving health through healthy people. And so both in 2020 and in 2030, they have specific health objectives about improving the health of our LGBT patients, and making sure as providers we're creating you know, health infrastructure that builds on that. So I would agree with a very important message you were saying there, which is we as healthcare providers or healthcare providers in training owe it to the communities we serve to make sure that we are addressing the health needs of every person.
There may also be some people, I'm sorry, you know, I just got to say this.
Go ahead.
Some people who are not even giving direct care, but they're insisting they're leadership positions that can make a difference on how are forms done. Our informatics specialists who are really, you know, understanding that there has to be more than 2 boxes to click, you know, in certain things. And, you know, the more you know, so our nurse informaticists, our nurse and healthcare leaderships, they can take leadership roles in making changes to be more inclusive to all patients as well. So I do want to make that healthcare thinking very broadly.
And Mavis, that is actually happening right now at Vanderbilt. There is a big IT initiative that's going to link in with the electronic medical record and how we check patients in and what the whole process is. So that's exciting. I
already am just seeing the complexity of this and how, as a DNP student, I learned that, or part of what DNP is all about, doctor of nursing practice, is to bring the research, PhD level research, and apply it to practice. You know, and so I think it goes with policy and with education and so many other things. And there's, I guess the word out on the street is that it takes 10 to 20 years even to translate all this into practice. And there's hubs where it's happening more than other places, from urban to rural. And it all comes back down to that patient and provider or other person relationship and that safety. And I saw Kelly nodding her head when Mavis was talking about just that basic concept of people just need to know about what this is and how we connect and how to treat. And yeah, so and I'm not going to go into this because I'd like to go into other topics, but there's the idea of educating educators. So that's another topic for another day. And as an educator, where do I learn, how do I learn about how to teach this as well? So I'd like to skip forward and look into, for one, well, a simple question. So what are the main differences between transgender care and cisgender care? Well, that's not simple at all, is it? But go ahead if you want to answer that very, very briefly. Tell me what you think. Are there a few differences that you could highlight, and then we'll move on from there? Or you can just say skip. Yeah.
I'm happy to weigh in on this, and I was, you know, we talk about being people smart, and Nicole expressed that in the way that she addressed that patient that she had, who said, "I think I'm a boy." She didn't have an answer, and she was honest and transparent and said, "Let me do some research and get back to you on that." When I started my transition process and I was meeting with Dr. Taylor, we had very specific conversations about the differences that my body presented versus that of a cis woman, because that was the reality of where we were at, right? I still had parts that weren't a normal cis woman didn't have. And I didn't have other parts. And we had to be honest and come to that realization that how she treats me as a patient is important, and we needed to talk about those things. Once I had gender affirmation surgery, there are still significant differences. And those differences have to be addressed in a medical setting. And no matter how much I want to, that will never change, barring some crazy technological advances. But anyway, you get my point, right? You know, I still have a prostate, so I still have a cancer risk there. There are things that I'll never need. I'll never need a Pap test, but I am going to need mammograms. For trans men, their health needs are probably going to mirror those of cis women in many respects for years. But those differences are significant, and I think they have to be recognized. And I think practitioners have to be honest with their patients about that. I will tell you one story though that just happened recently, and it kind of breaks my heart. But a friend of mine who's a trans woman went to a Vanderbilt practitioner, not somebody that she's seen before, recently for a pain in her lower leg. From what I understand, the practitioner out of the blue comments that, oh, you weren't born with a uterus. What? Where did that even come from? How did that even apply to the reason for the visit? We have access to information that's crazy today. And as practitioners, you're going to get to see things in people's charts that may or may not relate to their specific circumstance, but I don't think that gives us license to comment on it all the time. And that's what I meant. That's what I meant earlier by being people smart.
Kelly,
Thank you, Kelly.
As you were talking, Kelly, I was thinking of, you know, you talked about the fact that sometimes there are instances that it does become important that you have certain parts of your body and don't have certain parts of your body, and that sometimes that impacts the care or the screening or exams that you need today at this visit, and there are other times it's not relevant. And I'm just, every time I think of that, I really think of the fact that, you know, but we all have hearts, we all have livers, we all have stomachs, we all have lungs, and all those parts of us are the same. And are there some specialized care sometimes that's needed? Yes. But I'll never forget the referral I made for a trans woman who who had a mass in her chest, and I sent her for a mammogram, and I was so horrified on her behalf when the radiologist felt like it was their role to say, this person is not genetically female and therefore doesn't need this screening that you sent them for. That wasn't accurate. That wasn't true. Cisgender men develop breast cancer. And it was certainly never that radiologist's place to say that and put that in a record. And I just sat and cried with that patient. I was so horrified that someone would feel they could say that. And I think it really highlights why it's so important that there's a lot of times the parts that you have today are the parts you have today. And we need to help you get the right care.
Nicole, can a provider refuse to care?
I think just like that radiologist did, I think of another time a patient brought me a letter from an endocrinologist who refused to care for a person. I think it highlights the reason that it is important to work, if you're in a position to work on those policies within an organization. You know, endocrinologists actually have excellent guidelines on the care of transgender individuals. Do people refuse to offer care? Yes. Do I believe that is ethical or moral? No. And I think that's maybe a good place as we're kind of getting, you know, into our hour here. I don't know, Carla, if you want to talk about some of the legislation that's going on now. I know we've all been watching it closely along this very line of the issue of refusing care.
Yeah, there's been a couple of bills that are out right now, two that are under different numbers, but very identical, almost to the letter and punctuation the same, that they're very specific towards prepubescent, I have trouble saying that word, prepubescent and adolescent gender diverse individuals, and that are almost to the point making it impossible in specifically more rural areas of Tennessee for these children to receive any type of care, and doctors who do provide this care are medical professionals, including the question is also mental health professionals to provide this care, make it a criminal offense. There's a current legislation out there right now that is saying to provide that it's going to be illegal to provide pubertal blockers to anyone that is under the age of puberty, which kind of makes me go, then you don't know what a pubertal blocker is.
Exactly.
But,
it's so uninformed.
Yeah.
It doesn't even make any sense.
You don't put someone on a medication that they don't need until they need it. And then it says for older adolescents that it requires the sign off of 2 doctors and a psychiatrist before that they can begin gender affirming treatment. And it's so uninformed, and the representatives who are pushing the bill don't even believe that transgender individuals exist. They think that in the quote was, it's an absurdity. And as a social worker, I'm not in the nursing perspective, but I've worked with nurses closely the last almost 15 years. It's ridiculous to think that these individuals aren't in our community and haven't been in our community for a long time, forever. And so giving them the opportunity to be able to affirm who they are and to be able to feel that they're able to go and get medical care, and for the doctors to feel that they are, and nursing providers, that they can provide that care without fear of retribution from the government is key. So from my plug, please go and research these bills, and kind of, you can just Google Dr. Google, as I say. Google is a social worker's best friend. Is just Google Tennessee transgender bills, they'll pop up and you can read them. There's definitely representatives out there that are advocating against them. And so just reach out to them, offer support, and kind of educate yourself and be a voice in the community with your peers, with your colleagues, with your families, that these individuals need care and they need to be treated with respect, just as you would any other individual. They're still people.
Carl,
Thanks so much, Carla.
Exclamation.
Go ahead, Kelly.
I'm sorry, go ahead, Chance.
Oh, I just said, go ahead, Kelly. Yes.
Okay. So a lot of this legislation that's moving through Tennessee right now is happening very quickly.
Yes.
The next week is going to be really crucial in terms of letting our representatives know where we stand on some of these bills. And I was talking to a friend of mine today at the Tennessee Equality Project, and he was telling me that if any of us want help in either crafting a phone script or an email to our legislators, that he is more than happy to help do that. And as a matter of fact, said he's also available to help us do Zoom calls to our legislators, because those conversations, particularly for folks outside of Nashville proper, are really, really important right now. Most of the legislators in Nashville proper are really on our side. But when you start getting out to some of the surrounding counties and the more rural counties, those are the folks that really need to hear from their constituents about these policies and how detrimental they are. So I would encourage anybody. It's tnep.org, really simple acronym. Chris Sanders is the person I was talking to today, and again, he is more than happy to help support any initiative that will get you in front of a legislator or get your words in front of that legislator so they know how you feel.
Excellent. That was my next question, is how can someone be an active ally? So if anyone has another mention, how can someone get involved in that? Any other comments on that before we move to questions from the audience?
That's a great primary source to start. Yeah.
Excellent. I wanted to mention the Trans Buddy program just briefly because it is very important, and maybe Kelly could tell us a little about that and how a person gets connected.
Absolutely. So the Trans Buddy program is led by Sean Riley. She's the Trans Buddy coordinator. Sean is such an amazing individual. I absolutely love him. But the Trans Buddy program, their goal was to increase access to care and improve healthcare outcomes for trans people by providing emotional support to transgender patients while they were having their healthcare visits. COVID has changed the rules on all of that. So we're not allowed to personally go out and be with patients as they go to their doctor's appointments. But it has been a really amazing program, and a lot of people have taken advantage of it. There's over 31 volunteers that were doing this before. And in 2019, I don't have more recent stats, but in 2019, over 255 patients had somebody from the Trans Buddy program go with them. So monumental, huge benefit to the trans community.
Yeah.
And there is still support by phone. We don't have anybody going out and visiting personally now, but those things are still available by phone.
I was just going to add that nursing students in the past, when they could go on visits, did sign up to be trans buddies, students that are local. So that's a way of serving in that way, being an ally, helping the population without providing direct health care, but still helping with, managing through the healthcare system, which as a student, you're going to learn in that role, just serving in that way.
Yeah. Sean did an amazing job in providing really top-notch training for people. So you can sign up to be a trans buddy, but you have to go through training, and the training that Sean did was just incredible.
Yeah, and we even have, pre-COVID, of course, we would have a trans buddy that would come to our transgender clinic day that would go and meet with all of our teens and their families. And because sometimes the parents also need that support and that education, because they're nervous and scared as well as kind of what reaction their children are going to get. Very protective, and understandably so. So it's a great program, and it's very easy to reach out. And it's pretty much 24/7 that there's a phone number that you can contact.
Mm-hmm.
Kelly, maybe you said it earlier, but I just wanted to ask a clarifying question for the Trans Buddy program. Is it only for folks who are going to get their transgender specific care, or is it to any healthcare appointment?
It's to any healthcare appointment. I know one of the things we talk about sometimes is the web of care, and I mentioned my friend earlier that didn't have a great experience. When we go to a trans-friendly provider, we have this certain expectation of care that we're going to get, and it's typically very affirming, and everything's handled very, very well. But when we get referred to another physician, whether it's part of the Vanderbilt community or not, we have no idea what's going to happen. And honestly, I've been taken off guard. I got referred to a specialist for something that I needed to address, and the person who was caring for me was a cis man, and he was visibly uncomfortable and referred to me as sir several times. It's gonna happen. Everybody's level of acceptance is different, and whether it's through education or training or personal commitment to the issues at hand, we're not always as visible in the community as we think we are. And if that provider had never been exposed to a transgender woman before, I'm not surprised. I'm really not. And it's one of the reasons why I like these opportunities, because I think the more visibility we have in the community, the better for the whole community.
Kelly, in that instance, and thanks for sharing that. I'm so sorry. I hate it every time I hear that. But in that instance, like, what would the support that a trans buddy person might offer in that situation? What would that look like? So you as a patient you need care. You need this specialty care. There probably aren't a lot of those specialists that offer. I don't need to know what kind of care, but so what might a trans buddy do in that situation that would help, that would be supportive of you as a patient in that room?
So they would have been an advocate for me. And they may have very gently reminded the provider that I'm a woman, and I'm not a sir, I'm a ma'am. And they're not there to create conflict, but they are there to advocate for the patient.
Mm-hmm. Yeah.
Sometimes,
Go ahead, Mavis.
I would imagine, Kelly, it's on your side how difficult that is, and then thinking about some of the listeners that are afraid to use pronouns because they're afraid they're going to use the wrong one. That is that at the same time when we mess up, to just acknowledge that. And I bet if he flip-flopped back and forth, he probably knew he was messing up. And was he doing it on purpose, or was he doing it unintentionally and then he didn't speak to it and you didn't have an advocate to help you just address it? And so it really puts an undue burden on you. But where I flip it the other way as learners in that space for anybody on here is that if you mess up, just say, oh, I'm so sorry. I'm going to get that. And I want you, if I say the wrong thing, I want you to just tell me. We shouldn't say how hard you're making it for me, and that has nothing to do with it, and those words don't come out of our lips. But the part about I'm please ask, asking forgiveness is fine. I mean,
Yeah.
On a lot of things when it comes to healthcare, you cause someone pain unintentionally, you acknowledge that. The pain can be physical, but the pain can be in other ways as well. And this is one of those. You just acknowledge that and try to correct yourself.
Yep, definitely. Apologize and move on.
Don't obsess on it, just go on. Yeah.
A spirit of humility and curiosity, and just politely tell me what would you like to be called? Yeah. Wow. Things we learned in kindergarten as well.
Yes.
Amazing. Let's go back to it. Thank you so much. We've just got a few minutes left. You've covered some of the things that I was going to bring up as well, such as ways to avoid feelings of gender dysphoria for our trans or gender nonconforming patients and coworkers. I think you've touched on some of that, and there'll be some resources in the list. With the last 4 or 5 minutes, are there any closing comments, any things that you didn't get to share that you'd like to put out there to the audience? And if there's anyone who has a last minute question they want to get out, now is the time.
So Chance, I think one person asked a question I don't know how to respond to. They said, how difficult is it for a patient to designate a preferred name and their pronouns on My Health at Vanderbilt so that
Vanderbilt My Health
avoided? So that's a real Vanderbilt specific thing, maybe somebody that works in.
Yeah.
Barbara, now?
I'm going to say, I don't know that you can do it directly in the app itself or in the website. But when you're at your medical provider, it's very easy for the medical provider to put in your preferred name and to kind of make those markers that of your preferred pronouns and things like that on the appointment side. Like, so once you're in front of an individual, but from the patient perspective, you can't make those changes. You just have to call and ask. Someone can simply do that by calling like the patient line and can you please update my preferred name? To make changes to your legal name, there is a little different perspective that requires just a quick little proof of change of name, just so that we make sure it lines up with your insurance, because we don't want a bill to not get processed correctly and you to end up with something. But again, that can be something that can be handled very quickly on the backside, even after the fact.
Great. Thank you. All right. Kelly, is there anything else you would like to tell the audience or the panel today that from your heart, anything you'd like to share? I want to leave with that.
Yeah, that's good. That's good. Thank you. I led off with the question, what does it mean to be transgender? And I think what I want to close with is, I'm a real person, just like every one of you sitting here. I have a family, career, mortgage, car payment. I mean, we're all experiencing life together. I happen to be transgender, which means that my mind didn't align with my physical body, and now it does. I just want to be treated like we would treat anybody else. And I want to treat people that well also. We're all in this together. We don't have a choice. You may not like me. You may not agree with my choices, life choices. That's okay. I don't have any control over that. But we're all humans and we're all doing the best we can. And I think we could do that together. And so I invite all of you to join us on this journey because it's life and none of us are getting out of here alive. Sorry, that was a bad joke.
That's my kind of humor. Amazing. That's right. Thank you so much for your courage and for your for sharing, right? And thank you all for participating, the ones who came. So we're all part of this movement right here. Like she said, we're all in it together. And we can take what we've learned here and we can go out and carry this message and use the resources that are going to be available. And certainly you can contact with further inquiries, questions, and we'd be happy to speak with you as well. So yeah, I believe that's about it for today. We're right down to the minute. And who knows, if there's enough interest, we may have another panel as well. So does anyone have a formal closing, the way we say goodbye here? What language we use? All right. Well, thank you so much. Have a great evening and take care.
Thank you so much.
Bye.